Warming and hygiene. Hi, my name's Jen. I'm going to be your nurse for the day. Can you tell me your name and date of birth?
Yeah, my name is Velma Van Ostren, 31673.
Perfect, Velma. So I see you're in today for your annual physical exam. Is that correct?
Yes.
Do you have any concerns before we start?
No.
Okay. So can you tell me where we are?
In Jefferson City, Missouri, in the doctor's office.
Okay, and can you tell me the year?
2020.
Okay, and the president.
Donald Trump.
Okay, it looks like you're oriented to place and time, so that's good. We're going to get your vital signs. It looks like your blood pressure is 140/92 and your pulse is 77. Can you tell me if you have any pain today on a scale of 0 to 10, what that pain would be?
2 sometimes, just because I've got arthritis in my hands.
Okay, and do you take anything to alleviate that pain at all?
Just Tylenol, ibuprofen.
Okay, and do you use a warm compression pack or anything like that? Okay, and does that help?
Sometimes.
Okay, and is the pain dull, achy, stabbing?
Just a dull pain.
Okay, alright, and I've been counting your respirations when we did this, and it looks like it's about at a 16, which is in the normal range for respiration, so that's good. Can you tell me your height and your weight?
Yes, I weigh 130 pounds. I'm 5'4".
Okay, perfect. So can you put your arms out here for me? I'm going to assess your skin, and what we're looking for is just that it's nice and smooth, that there aren't any abnormal lumps, bumps, lesions, anything like that. I'm going to have you turn them over for me. They're nice and smooth on that side. It's like they're warm, dry, no moisture. Your cap refill is less than 3 seconds. You don't have any tinting, which is nice and good. And I don't see any scars or any abnormal moles or anything. Do you have any concerns in regarding to your skin?
No.
Okay, so next what we're going to do is I'm going to assess your head. And so you're going to feel me touch you. And what I'm looking for here is I'm just looking for the distribution of your hair. I'm looking for, which is nice and evenly distributed. I'm looking for any lumps, bumps, redness, swelling, any abnormal moles. Do you have any moles up here that you've noticed that you want me to check out?
No.
Okay, so do you have any pain when I feel around on your head? I'm not feeling any lumps or anything. No. Okay, all right, good. So next I'm going to feel you remove your glasses for me. Okay, I'm going to feel your temporal artery. It's nice, strong, and equal. And then I'm going to feel your sinuses. I'm going to touch them and palpate them. So just let me know if you feel any pain or tenderness.
Okay.
Do you feel any pain or tenderness?
No.
Any pain or
No.
tenderness? Okay. Can you open your mouth for me? Close it. Okay, I don't feel any popping or crepitus. Does that hurt at all when you open your mouth? Okay. Alright, and your skin looks nice and clear. I don't see any acne, any scars, any signs of skin cancer or anything like that. So next what I'm going to do is I'm going to assess your mouth with my pen light. So if you could open your mouth for me. Okay, your teeth look nice and white. I don't see any cavities. Your lips look nice and soft and smooth. They don't have any chapping or bleeding or cracking. Your tongue looks nice and pink. No abnormal lesions. Your lips, or your gums, look nice and pink. There's no redness. Your soft palate looks nice and pink. No redness or lesions or sores. Same with your hard palate. If you could stick your tongue out for me so I can look at your tonsils. Your tonsils are present and they don't look inflamed or anything like that. Do you have any worries or concerns with your hard palate or with your tonsils? Okay. Have you ever broken your nose?
No.
Okay. So I'm gonna look in your nostrils. They look nice and patent. I don't see deviated septum. Your nose looks nice and straight. Do you have any drainage or anything like that with your nose at all?
No.
Okay. And can you smile for me? Open your mouth side to side. Close your eyes and open them. Okay. Do you ever notice any facial drooping? Does your face ever go numb randomly or anything like that? No? Okay. So now what I'm going to do is I'm going to look at your eyeballs. And what I'm looking for here is just that your pupils are round and equal and reactive to light and accommodation. Your sclera is nice and white. I don't see any yellowing or anything like that. No opaqueness of your corneas or anything like that. Your conjunctiva look nice and pink. I don't see any drainage or anything. I don't see any scales or blepharitis on your eyelashes or eyebrows, and I don't see any styes or anything like that, so that looks nice and good. So what we're going to do now is we're going to do a couple tests. The first one we're going to do is called the confrontation test, so I'm going to sit in front of you like this, and we're both going to close the same eye, like so. Actually, let's turn this way. Okay, So we're going to close the same eye, and I'm going to hold up numbers in different planes. And then the next one, I'm going to bring this up, and you're going to tell me when it comes into your peripheral vision.
Okay.
Okay? So, close one eye.
2, 3, 2, 2,
Okay, now your other eye.
2, 2 or 3, 1, 2.
Okay, now we're going to cover your eye and tell me when this gets in your peripheral vision.
Now. 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 Now.
Okay, cover your other eye. We're going to do the same thing.
Now. 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 Now.
Okay, and then next, what I'm going to have you do is I'm going to have you follow my pen. We're going to do the 6 cardinal gazes of vision. And what we're looking for here is that both of your eyes just follow the pen line evenly, and there's no shaking or deviation of one eye. Okay? Good. So, next what we're going to do is I'm going to have you hold this out in front of you, like so. Cover one eye, read the first line, cover the other eye, read the first line, and then we'll go down, and then let me know when you can't see it anymore.
Okay. So, E-A-S-T-E-R.
Okay, cover your other eye.
E-A-S-T-E-R.
Okay. Now go down to the next line.
C-A-R-E-H. C-A-R-E-H.
Okay, perfect. Thank you. All right, so your eyes look good. What I'm going to do now is, I see you have glasses. Do you just use those? Do you use those for reading, or do you wear them every day? Do you have contacts?
Reading and computer work and
Okay.
for seeing things more close up, yeah.
Okay, good. And do you have any concerns with your eyes today at all?
No.
Okay, so next what we're going to do is we're going to move on to your ears. What I'm going to do is I'm going to look at your external ear first, and what we're looking for is just any redness, lesions, bumps, lumps, any drainage coming out of the ears, which I don't see any of that. I'm looking behind your ear at your mastoid process on both sides, and I don't see any swelling or anything there. Do you feel any pain or tenderness when I palpate your ear at all?
No.
Okay. Now what I'm going to do is I'm going to look inside your ear, and what we want to see is that there's no redness or swelling or excess drainage. Some earwax is normal. In your eardrum, we want it to be nice, opaque, and intact. Okay? Alright, so that looks good on that side. Do you have any pain when I look in your ear at all?
No.
Okay, good. So the next thing that we're going to do is called the Ryan and Weber test and the whisper test. So the first test we're going to do, I'm going to hit this on a hard surface, and it's going to start vibrating. I'm going to put it in the middle of your head, and you're going to tell me which ear you hear it best out of, or if you hear it equally in both ears, okay? If you hear it in one ear, it's called lateralization, and that's abnormal.
Okay.
You should hear it equally in both ears, okay?
Both.
Okay, good. Next, we're going to do a test where I hit this on a hard surface, it starts vibrating again, I put it on your mastoid process, and then I bring it up. And where you're going to tell me when you stop hearing it, when it's on your bone, and then when I bring it up in the ear, you're going to tell me once you stop hearing it. Okay?
Done. Done.
Okay.
Done. Done.
Okay. And now we're going to do the whisper test. So I'm going to stand behind you and whisper something into your right ear and then into your left ear, and I'm going to have you repeat it. Okay?
Blueberry. Cat.
Perfect. Okay. So next what we're going to do is we're going to move on and we're going to look at your throat. So what I'm looking for here is that it's symmetrical, that there's no abnormal lumps or bumps. I don't see, in some people's throats you can see a visible pulsation. I don't see that in your throat at all. I'm going to check your carotid artery, nice and strong and equal on both sides. Then I'm going to check your lymph nodes. Let me know if you have any pain when I touch them. They don't feel swollen at all. Do you have any pain when I put that touch? Okay. Next, I'm going to have you swallow as I move my hand down your trachea. So swallow for me. Okay. And I don't feel any abnormal lumps on your thyroid gland or anything like that. I saw in your chart you have hypothyroidism. Do you follow your medication regimen with that?
Yes.
Okay. In your neck, I don't see any abnormal redness or lesions or anything like that. Do you have any concerns when it comes to your neck at all?
No.
Okay. Can you move your neck forward and back? And then touch your ear to your shoulder. Do you have any pain or limitations with that?
No.
Okay. So next what we're going to do, I've done your head, so I've done your eyes, your nose, your mouth, your skin, your ears, your scalp, and now your neck. So now what we're going to do is your upper extremities, and we're going to check their range of motion and their strength. So if you could move your shoulders up and down for me, and then try to touch your fingertips behind your back on both sides. Okay? And then move your elbows out, like almost, and then like you're eating kind of. All right, and then move your wrist up and down, side to side, and move your fingers in and out, side to side. Okay. Any difficulty doing that? Okay. Now I'm gonna have you move your shoulders up against strength or up against resistance, and then I'm gonna have you like push your arms forward against resistance, and then move them back against resistance, and then same with your wrists, move them up, and then like you're pulling them in towards you. Okay, perfect. And then now what we're going to do is I'm going to assess your back, and then I'll assess your chest and your heart, and then we'll move down to your abdomen and then your lower extremities. Okay? So I'm going to remove this pillow from behind your back right now, and I would usually have the patient in a gown with the back open to the back. So what I'm looking for here is I'm looking for any abnormal redness, lesions, lumps, bumps on her back. I don't see any of that here. I'm seeing that her breathing is symmetrical and equal. She's not one side moving more than the other. She is not having any difficulty breathing. It doesn't seem like, are you having troubles breathing at all today?
No.
Okay, so I'm going to have you say 99 for me.
99, 99, 99, 99.
Okay. And I'm going to palpate, so let me know if you have any pain or tenderness with this. And I'm also looking for any lumps and bumps while I do this. Let me know if you have any pain. Any pain?
No.
Okay. And I didn't feel any lumps or abnormal anything like that. So what I'm going to do next is I'm going to percuss down your back. And what we're doing here is we're listening for any abnormalities in sound. And we're doing this around your scapula. Okay, that sounds good. So what I'm going to do now is I'm going to listen in the same spots that I percussed. So I'm going to have you breathe in and out with each one and each new spot. And if you get dizzy or lightheaded, just let me know and we'll stop. Okay, that sounds nice and good. I didn't hear any adventitious breath sounds. Do you have a history of smoking? Do you have a history of lung cancer in your family, emphysema, anything like that?
No.
No? Do you have any problems breathing ever, asthma?
No.
Okay, perfect. So now we're going to do the same thing on your interior chest. So what I'm doing is the gown. I'd usually have the patient in the gown as well, and I would be looking just to make sure that she's not using any of her external muscles to breathe, that she's not having any difficulty breathing, which it doesn't look like you're having any difficulty breathing. Your chest is nice and symmetrical. I don't see a barrel chest or anything like that. So I am going to palpate around your chest, and I'm going to have you let me know if you have any pain or tenderness when I do that. And as I do that, I'm just going to be looking for any abnormalities like lumps or lesions or redness or anything like that. So let me know if you have any pain at all. Any pain or tenderness when I do that?
No.
Okay, now I'm going to go ahead and percuss down as well. Okay, that sounds good. So now I'm going to listen in the same spots and like the back. If you could breathe in and out for me while I do so.
Okay.
And let me know if you get lightheaded or dizzy. That sounds good. Now what I'm going to do is I'm going to look at your heart. So what we're going to do now is I'm going to palpate a couple different spots, and then I'm going to listen in those same spots, and then we'll have you lean forward, and I'll listen in two different spots as well. And what I'm listening for is any murmurs, thrills, or peeves, any abnormalities like that. Do you have any heart problems in your family? Hypertension, hypotension? Okay. So first off, I'm just going to palpate here. Let me know if you have any pain or tenderness when I do that. Okay. Any pain or tenderness when I do that? No. No? Okay. So. Okay. So now I'm going to listen in the same spots, and then I'll have you lean forward. Now I'm going to have you lean forward. Okay, that sounds good. I don't see any, or I didn't hear any murmurs or abnormalities. Do you have any history of having palpitations or anything like that? Okay, so now what we're going to do is we're going to move down to your abdomen. And usually I'd have the patient have the gown on, and I would actually look at the skin and everything. So what we'd be looking for is if there's any distension, any abnormal contour of the abdomen, which I don't see. I don't see any fluid buildup or anything. It looks nice and soft. And then we would look at the umbilicus for any redness, swelling, if it's protruding when it used to not. And do you have any difficulty going to the restroom or anything like that? Are your bowel movements frequent?
Yes.
Okay. Do you have any flank pain?
No.
Ever? Okay. So now I'm going to go ahead and I'm going to listen, and then I'll percuss your abdomen, and then we'll do a light palpation and then a deep palpation. Your bowel sounds are nice and active, and I don't see any redness, lesions, or anything like that on your skin, any abnormal lumps or bumps. So next I'm just going to go ahead and percuss in the 4 quadrants. Okay, and now I'm going to do a light palpation and a deep palpation. Do you have any areas of extreme tenderness that I need to be aware of? Okay, so I'm just going to do a little bit of a light palpation in each quadrant and around your abdomen. Now I'm going to do a deep palpation, so this might let me know if you have any pain or tenderness with this. I don't feel any abnormalities, any abnormal lumps or bumps, so that's good. Okay. That looks good. Any concerns there?
No.
Do you take laxatives often?
No.
Okay, so now what we're going to do is we're going to do your lower extremities, and then we'll move on to your neurological part of the assessment. So what I'm looking for here is pull this back. Alright, so what I'm looking for here is any abnormalities, like any lumps or bumps, and I don't see anything like that. I don't see any signs of skin cancer. Your skin feels nice and warm and dry. There's no redness or swelling. I don't see any edema. I'm going to just go ahead and check your pulses. That's nice and equal and strong. Nice, equal, and strong. And then we'll check your pedal pulses. Okay, nice, equal, and strong. And then can you move your feet up and then down for me? Okay, and then 1, 2. Okay, that's good. Okay, and now we're going to check for the range of motion of your lower extremities. So what I'm going to have you do is I'm going to have you bring one knee up and then put it back down. Bring that other knee up and put it back down. Can you do that for me? Okay. Do you have any pain or tenderness when you do that? Okay, next I'm going to have you kick your knee out like so, and then kick your knee out like so. Okay. Any pain or tenderness when you do that? Any popping? Okay, now move your ankles up and down for me, like this. Or your feet up and down. There you go. Okay. And now I'm going to check your capillary refill on each toe. Generally, we would remove your toenail polish to do this. And they're less than 3 seconds. Okay. Now what we're going to have you do is I'm going to have you do your neurological assessment. So first off, I'm going to have you, we're going to test your coordination if you can move your thumbs to each finger. Okay. And then can you bring your hand there? Now, what we're going to do is we're going to test your senses. So I have a soft touch, which is like this, okay? And then I have a knife. And what we're going to do is I'm going to rub it and I'm going to heat it up till it's warm. And tell me if you feel what you feel.
Warm.
Okay. And then I have a cool touch, which feels like this. And then like a poke, sharp. Okay, so I'm gonna have you close your eyes, and you're gonna tell me where you feel the sensation and what you feel. Okay.
A poke on my right cheek.
Okay.
Soft on my left. Cold on my right arm. Warm on my left leg. A poke on my left arm. Soft on my right leg. A poke on my right foot. Warm on my left foot. Warm on my left foot.
Okay, you can open your eyes. Okay, now what I'm gonna have you do is I'm gonna have you walk right in front of me here. You can just walk right here like normal, and I'm gonna assess your gait. Oh, okay. Okay. Now, when you come back, do heel to toe. Okay. Now face that way and stick your arms out.
Straight
Close your
or on the
eyes.
side.
Arm straight, and then close your eyes. Okay, good. Did you feel dizzy or anything?
No.
Okay, good. Now I'm going to have you bend forward, and I'm going to assess your spinal column. Usually I would have the gown open to the back, and you can come back straight up. And your spinal cord is nice and straight. I'm going to palpate it. Do you feel any, does it hurt at all whenever I palpate your spinal cord?
No.
Okay, now we're going to do range of motion of your spinal cord. So can you move side to side, forward to back? Anything like that? Any problems there?
No.
Okay, you can sit down. And now we're going to do deep tendon reflexes. So, this is my hammer. And then do it on your knee. Oh, sorry. It's hard. Lately. have any concerns at all?
No.
Okay, so what we're gonna do is we're gonna report these findings to the doctor, and if he decides that you need to come back for a follow-up appointment, it's important that you come back for that, just to make sure that you're healthy and that everything's going good. And it's also important that you have your annual physical checkup, just to make sure that you are on track and that we can keep on top of your health. So
Okay.
it was nice to meet you.
Nice to meet you.
Doctor will be with you shortly.
All right, thanks.
Thank you.